And as a matter of fact, there is what we call a subspecialty board in facial plastic surgery, only they don't call it facial plastic surgery anymore. Now they call it plastic surgery in the head and neck region, which I think is probably a good change, because facial plastic surgery implies that it's just in the face. I mean, when you talk about plastic surgery in the head and neck region, it really kind of gives you a much better sense of what the doctor might really be doing, because some people might not think that the ears are part of the face, or the back of the scalp is part of the face, or the hair, or even the neck area. And so these are areas that would be embraced with the terminology or the designation of plastic surgery in the head and neck region. The other point, now that we're talking about boards a little bit, is that there are some boards besides the plastic surgery board that are members of the American Board of Medical Specialties. Mm-hmm. Now, the American Board of Medical Specialties is an organization that's been around for over 75 years, and that's the board that accredits training programs that train physicians to be board certified in a given specialty. And I think that there's actually 24 boards, member boards, of this American Board of Medical Specialties that include allergy and immunology, anesthesiology, colon and rectal surgery, dermatology, emergency medicine, and so on. The cosmetic surgery board is a little different. They're not a member of this American Board of Medical Specialties. That's not to say that the cosmetic surgery board is not a legitimate board, but it's just not a member of this organization, which has been around for a long time. This is an advisory group to universities and to the AMA, and so they're pretty well entrenched and well connected. But besides these 24 member boards, there's probably 150 subspecialty boards that are also spin-offs of these member boards. But being board certified, of course, is something that we think any prudent patient would certainly want to ascertain of their doctor before they submit to having surgeries done. Right. And so I would encourage anybody who's contemplating surgery to do that. I would also encourage patients that go to a doctor and discover that doctor wants them to get medically cleared for surgery, that they get medical clearance. Because, a while back there was a plastic surgeon in California who operated on, I believe it was Kanye West's mom, and did abdominoplasty and some other things, and there was a very dismal outcome of that. And one of the criticisms was that the West family, had shopped around and been to some other plastic surgeons, one of whom said that she needed to go get cleared because there were some things in her medical history that he was not comfortable with. And she met with this particular surgeon who in fact did the surgery that did not require, this is hearsay, this is what I've heard from the media, I don't know in great detail, but the general point being is that there are times when shortcuts are okay, and there's times when shortcuts are not okay. And I know, as you know, in our practice, anybody who is 50 years of age or older automatically has to have medical clearance from an independent medical person. Right. So that we have some other opinions about their health and the wisdom of proceeding with surgery as an outpatient under those circumstances.